Okay, this video is called Transplant Rabies. I recently got a phone call from one of my old doctor friends, and he says, "Hey, Pete, you ever heard of acute ischemic encephalopathy in the brain? That's a lack of blood flow to the brain. Often happens from hypotension. It's actually relatively common." I go, "Yeah, I've seen that lots of times." And he goes, "Can that acute hypoxic ischemic encephalopathy, can that look like rabies of the brain?" I said, "Gee, probably, but I don't know. I've never seen rabies of the brain. I've been a doctor over 30 years, but I've never seen rabies in a brain." And he goes, "Well, could you find out for me, please?" Okay. I said, "Okay, let me look into it." So I looked up rabies of the brain, and here's a characteristic appearance of it. You can see that, by the way, here's what a transplant looks like. It's typically actually in the right side of the pelvis, and they just connect it to the iliac artery and vein, iliac vein, the vein outflow, and then the ureter is just implanted into the urinary bladder. The native kidneys stay in place. They're usually atrophic and of virtually no significance. Okay, so here is a brain with rabies, and there's a characteristic high intensity signal. This is a flare sequence, which is like a T2 with fat suppression, just meaning that fluid is bright. Okay, then you suppress the background fluid, suppress the background fat, thus accentuating the pathology. Pathology typically has edema, meaning fluid accumulation, swelling. So that's characteristic of abnormalities. Okay, so it's bilateral symmetric, and that puts you in the category bilateral basal ganglia, bilaterally symmetric. Toxic metabolic is your first category disease. So you look up toxic metabolic, or you should know them. Carbon monoxide, hypoglycemia, toluene, Wilson's disease, internal cerebral vein thrombosis, liver failure, Wernicke's encephalitis, okay? Methanol, arteriopercarone infarct, ADEM, okay? All right, and then you say, well, gee, or could it be an infection? And you don't even really think about rabies, but rabies should be on there too. West Nile virus, hepatic, herpes simplex encephalitis, Cryptococcus, toxo, etc. So anyways, yes, it could look like rabies. Yes, rabies can look like acute hypoxic ischemic encephalopathy. And so I said to my friend, this is in a different faraway place. I said, "Why do you ask?" And he said, "Well, a friend of his at some faraway place had a kidney transplant and then died soon after of rabies." And he said, the kidney transplant donor was declared brain dead because they said he had acute hypoxic ischemic encephalopathy. Okay. And then later on, after the recipient of the transplant died from rabies, they inquired some more with the family, and it turns out that the patient said that he had been sort of attacked by a skunk and scratched by the skunk. Perhaps he was bitten by the skunk. Okay, so anyways, it looks like that's what happened, that basically the patient was scratched or bitten by a skunk that had rabies, and he got rabies, and it caused rabies spread to the brain, and he died. So what's the lesson to be learned? First of all, this is super, super, super rare. And but it does say, stay away from skunks. And it also says, inquire a little bit about why, what happened to the donor. So anyways, transplant, kidney, dying of rabies, kind of interesting.